If you live with asthma, you know it's more than just an occasional wheeze. It's a constant awareness of your triggers, of the air you breathe, and of where your rescue inhaler is at all times. But the biggest source of anxiety can be the cost. The price of controller inhalers and specialist visits can be overwhelming without the right insurance. The good news is, the law requires that all major health plans cover asthma as a pre-existing condition. The secret is finding the right plan. In this video, we are breaking down the top 5 best private health insurance companies and plans specifically for asthma patients in the USA. Let's help you breathe easier, in every sense of the word. Our first recommendation is a Cigna Gold PPO plan. This is the top choice for flexibility. A PPO lets you see a pulmonologist or allergist without needing a referral, and a gold tier plan means lower copays for those frequent specialist visits and prescriptions. The unsubsidized cost for a family could be around $1,200 to $1,900 per month, but subsidies can significantly lower this. Our second recommendation is Kaiser Permanente's Silver HMO plan. This is for patients who want perfectly coordinated care. Kaiser is both your insurer and your provider, so your primary doctor, pulmonologist, and pharmacy are all in the same system. For managing a chronic condition like asthma, this integrated model is incredibly effective. A family Silver HMO plan could cost around $1,100 to $1,700 per month before any financial aid. For the best overall value with lower out-of-pocket costs, our third recommendation is the Ambetter Silver plan. Silver plans are unique because if your income qualifies, you get extra cost-sharing reductions that dramatically lower your deductible and copays for doctor visits and prescriptions, a huge benefit for asthma management. The unsubsidized cost is often very competitive, in the $900 to $1,600 per month range for a family. Our fourth recommendation, an Aetna CVS Health PPO plan, is for those whose main concern is prescription costs. As a CVS Health company, Aetna offers deep integration with their pharmacies, meaning easier refills and potential savings on medications. When you rely on daily controller inhalers, this integration is a lifesaver. A family PPO plan from Aetna would typically run about $1,000 to $1,800 per month at full price. Our final recommendation is a smart financial strategy, an Anthem Bronze HDHP, which is an HSA-compatible plan. This allows you to open a health savings account, HSA, with a powerful triple tax advantage. You can use this tax-free money to pay for your inhalers and doctor visits. The plan itself has a lower premium, and the tax savings are a huge benefit for anyone managing a chronic condition. Finding the right plan is about matching it to your specific needs. So, what's your priority? If you need the freedom to see any specialist, start by comparing Cigna's Gold PPO plans. If you value perfectly coordinated care, see if Kaiser Permanente is available in your area. For the best overall value with lower copays, get a quote for an Ambetter Silver plan. If your biggest concern is the cost of inhalers, your first stop should be the Aetna CVS Health plans. And if you want a smart financial strategy, research the tax benefits of an Anthem HSA plan. If this guide helped you breathe a little easier, please give it a like and subscribe. Thanks for watching.